Wow, thank you, Rick. Thanks for Tim. Thanks for the opportunity to be here to talk about UF Health Jacksonville. I actually have the most narrow focus of the presenters, and that is I have the job of just talking about what I do. You heard my background, and so sometimes people say, what happened? You couldn't find a job, but I stayed busy. I'm going to talk about really four things. What's a safety net hospital? That's really what we are at UF Health Jacksonville. I'm going to talk about, more specifically, UF Health Jacksonville. And I'm going to talk about why we're at risk, and I'm going to then talk about, show you what I would say is the face of the uninsured. Now, before I talk about the safety net hospital, and by the way, the safety net hospitals will be on the quiz for the students, so make a note, with the teaching public. But during the session today, this probably 4 hours, we've seen 40 people in our ED, and of those 40, 6 were probably uninsured. With something like the Medicaid expansion, whether we call it that or we use those parameters, 2 of those 6 would have Medicaid or some kind of insurance. So as Pat said earlier, we're not talking about providing the care. We provide it today. So when any of us decide we don't want health insurance and we get sick, we have a system that provides that care. What we're talking about is you don't see the cost because it's buried in various subsidies. So safety net hospitals are places that see more of these individuals. We at UF Health Jacksonville are probably, I call us, the canary in the mine shaft. We'll be the first place that goes broke in these safety net hospitals because we have the least amount of cash. And cash is king. I've probably got 30 days worth of cash, which for a hospital administrator is a nightmare. I also have another nightmare. Generally, when you run a hospital, volume and beds being full are really good. For me, it's not just beds full. Are they full with people who have some type of resource, or are they full with people who unfortunately don't have resources? So it's a system that we grew up with, and this idea is we really don't provide good care for people who don't have insurance. We just take care of them and then discharge them. So again, these are the safety net hospitals. What happens at them? Basically, most of the graduate medical education, there's the RIPID program, trauma centers, transplants, really the very acute quaternary work is done at these hospitals. Now I'm going to talk about, you can see 3 charts, and the important thing, all the Florida hospitals are responsible for about 25% of the Medicaid and the self-pay business. Medicaid 18%, self-pay 7%, 25%. Self-pay is no pay. Okay, it's not like the self-pay cash business, or if you're in the plastic surgery business, and there's a difference. Okay, so self-pay is no pay. So all the hospitals generically provide 25% or 25% of their patient days are Medicaid or self-pay. Now the safety net hospitals, the group that I just showed the list of, that jumps to 38%. And notice their commercial is actually 23%, it's pretty strong. So self-pay or no pay is 11%, Medicaid 27%. Again, it's a safety net group of 15 or 16 that I listed. Okay, now here's the real kicker. Here's UF Health Jacksonville, 51%. Okay. And what makes that even worse is the commercial is 11%. And so basically the cost shifting that goes on in the healthcare industry tends to go from commercial to the self-pay. So I have the kind of like the worst of all worlds in that I don't have enough commercial business to make the profit to support the high level of self-pay. So now I'm going to talk a little bit about what is UF Health. The hospital is owned by the city, fifth largest employer with a budget about $500 million, and we're affiliated with the University of Florida. Some of you have heard of Gators, even though some of us deacons we remember where we came from. The university has about 400 full-time faculty here in Jacksonville, and another 320 residents and fellows in training, and their budget's about $300 million, so almost $800 million on 8th Street. We're high quality. I'm not going to go through all of these, but 4-star rating from the University Health System Consortium. That's a group of 118 academic centers across the country that we believe is a peer group for us. We have magnet designation, Sterling Award, and we have a NCQA Level 3 medical homes. This is really the idea of these ACOs, accountable care organizations. So high quality, low cost. As an academic center, we are of the 118, we actually have the third lowest expense per adjusted discharge, and we have the lowest supply expense. So high quality, low cost, interesting payer mix. Why are we at risk? I just discussed this earlier, 51% Medicaid, self-pay, 11% commercial. We lost, just as all hospitals lost money over the last 3 or 4 years as the economy for Florida was, for the whole country, was depressed, and the funds that come through the state to help support disproportionate share funds, disproportionate share care was reduced from actually a high in 2008. And in 2012, that reduction was 16 million. We actually have lost about 45 million in total, and on a run rate, on an annual rate, we lost about $27 million of income a year to take care of the same people we're taking care of today. So, I mean, we didn't have a cut last year because the state budget's in balance, but that hit us hard. The next thing is, and by the way, the down bars are bad. The up bars are good. Center line is 0. Okay, so prior to those disproportionate share reductions, we were actually doing okay. Actually high water mark, $20 million back in FY10. I turn around here. FY11, that was actually anomaly of some debt we took on, but we were still operating positively. In 12, which is when we had major reductions, we also lost a major commercial payer. We lost $23 million. Last year, we lost 5, the June 30 year end. I'm proud to say, and my colleagues here would probably hold their breath, but for the first 3 months of this year, we are break even. And that's a good thing. And for a business guy, it's hard for me to say that's a good thing. So we are at risk because we provide care just as each of these hospitals provide care for people without resources. And the Affordable Care Act, whether it's Medicaid expansion or another program for Florida, we need to get money or insurance in the hands of patients that we are providing care for. And the last thing I'll say is, here's a face from a newspaper article about the uninsured. This lady is in St. Louis, Missouri, and she had a partial hysterectomy to remove a rare form of ovarian cancer. Shortly after that, she lost her job. She lost her employee-sponsored insurance. As a single adult. She doesn't qualify for Medicaid. So she has no way of having tests done. She doesn't have the money. So she has no way of having tests done to determine whether, in fact, the cancer has reoccurred or not. And her only option today is in one of our emergency rooms. It's really crappy care, and that's the system we have. Thank you.